listen, this is a historic moment. We in this state, for years, have not been treating our mental health patients with the dignity and the respect that they deserve, because when they need acute care, we've put them in a facility that doesn't dignify the quality of care that they need. And when we've promised community care, we haven't provided it adequately. Thanks to the extraordinary work, bipartisan work, of legislators, of advocates, of the healthcare system, we today are going to sign a bill that I believe creates the strongest community-based mental health system in America. It's a great moment for Vermont. We have a lot to be proud of in a country where we sometimes wonder whether anything good can happen in public policy because of paralysis in Washington. In Vermont, we seem to prove every single time that in the face of crisis, in this case brought about by Irene, we can make lemonade out of lemons. We can come out with a stronger system of care, and most importantly, we put patients first. That's what this bill will do today. How? Two ways. The first is we know that mental health illness and mental health patients don't want to be treated any differently than any other disease. If you're suffering from cancer, if you're suffering from kidney disease, you want the best quality care you can get as close to home as you can get it, particularly in Vermont. What this bill allows us to do is provide that care, deliver the services in communities that not only will be top quality, keep people close to home, but avoid the need for acute care beds, because we're providing the care, the preventative care, at the time where it's needed, close to home, through an array of community-based services. Second, in the event that you do need acute care, it allows us to provide that care closer to home. Southern Vermont, Brattleboro, Central Vermont, Rutland, Central Vermont, our facility that we're going to build right here near Berlin, Montpelier. So I just want to say how proud I am of the work that's been done.
I became a legislator in 1993, and the conversations about how best to serve Vermonters with mental illness was part of that discussion then, and has been part of the discussion every single year. Solely by virtue of the fact that I'm chair of, and I'm sorry, Alice, the best committee in the House, the House Human Services Committee, who put everything aside. And we made this our priority, and it's all we did for the first 6 weeks of the session. And I want to thank the governor for freeing up his staff, and the commissioner of mental health for freeing up his staff. Our committee grew from 11 to about, I don't know, standing room only. And it was all of that that made this possible. But by hearing from all of you, from hearing from the experts who have education, by hearing from the experts who are experts by virtue of the fact that they live with mental illness or their family members do, we were able to craft what I believe and what others have said will be one of the best systems in the United States. And we didn't just create services, it is now in statute as to what are the components of a mental health system. And we wouldn't have been able to do that in words that make sense without the direction of the governor, without the commitment of Speaker Smith to let policy and practice be the focus of this discussion. And we would not have been able to do this without the expertise of legislative counsel, Katie McGlynn, her first day coming in, her first year as legislative counsel, to write an exquisite, put our unformed thoughts into something that made sense. So thank you, Katie, for that. Thank you, community members, for helping us and educating us. And thank you, Governor, and thank you, Mr. Speaker, for putting your faith in the House committees.
My perspective concerning mental health matters comes firstly as a family member of persons who fell into the public mental health system, including both of my parents, among others. In addition, I have also been fortunate to have closely observed the experiences and struggles of others met along the way on occasion. This included listening to countless stories and the aspirations these persons freely shared. My own experiences within the mental health system over the years have proved to be informative and educational as well. In my view and assessment, when someone is experiencing a crisis of one fashion or another, including what are termed as being acute episodes of mental illness, whenever possible, the best, most preferred bed, or rather environment with which to experience healing, as well as being one that can better support a self-defined recovery process, is found within one's own residence, or otherwise a small home-like environment with an array of services and supports offered on a voluntary basis. However, until only somewhat recently, the problem is there had been too much focus as well as heavy reliance on institutional type beds and settings along the lines of the former, and thank you, Governor, Vermont State Hospital, that in large part are greatly dependent on the same old medical treatment model. What had been lacking and is needed instead is the building of a much more robust community-based system, one far less dependent on forced treatment as well as coercion and medication in general than has been the case up till now. Essential elements of such a system of care necessitate it be community-based, holistically oriented, highly flexible, responsive in a timely enough manner, proactively mobile, person-centered, and most important, trauma-informed. Key components required to ensure the success of this system of care include providing additional affordable housing opportunities, more peer-run drop-in centers and peer-run respite beds, as well as other services and supports sorely needed across the state. It is my understanding that much of what the mental health bill, thanks to these people here, will be putting in place as passed by the Vermont legislature, and which is being signed into law by Governor Shumlin today, is certainly heading in the right direction toward achieving a more balanced approach in order to do so. While this is something long overdue, it is most gratefully welcomed. Thus, it is with remembrances of certain family members, as well as those of numerous friends, acquaintances, and peers in mind, that compels me to thank all who have been involved in this ongoing and evolving process, and finally, reforming Vermont's mental health system. Thank you. Thank you.